Well, folks, we're visiting with a very special group of guests today representing Healthy Harrison. We have John Paul Nardelli, the Executive Director of Healthy Harrison, Amy Haberbosch Wilson, who is the president of the board right now, and Glenn Weber. He's a consultant and founding member of Healthy Harrison. Everybody, thank you for being here. This is a full house. Thank you all.
It's great to see you, Jim.
Yeah, I am looking forward to learning more about Healthy Harrison. I know a little bit about it. Can't wait to dive in and the impact that you're having not only in health in Harrison County, but across the state of West Virginia, and not just for health, but economic development too. So thank you guys.
Yeah, thanks for having us. It's an honor.
Positively West Virginia. Positively West Virginia.
Positively West Virginia is powered by Breezeline high-speed fiber internet and sponsored by Highmark West Virginia, Freedom Kia of Morgantown, and Humble Influence. With the help of these sponsors, we're able to share the positive business stories of West Virginians, including the one from today's episode.
John Paul, let's start right at the top. For our listeners who don't know about Healthy Harrison, give us an overview and tell us a little bit about Healthy Harrison.
Sure. Thanks, Jim. Healthy Harrison started in 2016 under the vision of President Gordon Gee at the time, and Clay Marsh and Bill Ramsey at WVU, with an interest to measurably improve the health and well-being of West Virginians. We typically land nearly at the end or almost always at the end of the health rankings across the country. So we're either 49th or 50th. We compete, I think, every year with Mississippi.
Yeah. Thank goodness for Mississippi.
Thanks. Yeah. It's in everything. So diabetes, lung disease, substance abuse, you name it, we're at the bottom of the list. So they had a really aggressive vision to measurably make an impact in the community. And they had this idea that they would start in Harrison County. And thanks to the collaboration between United Hospital Center and West Virginia University, we were able to create from ex nihilo, nothing, this new project where we would integrate experts in the field of wellness, medicine, education, economic development, really bringing all different types of minds together in order to impact and make a difference in our community.
Absolutely. John Paul, thanks for that overview. And you have a special anniversary coming up.
Yeah, we actually, because we started in 2016, this is our 10th year. And so we're really excited to be able to just reevaluate all the success that we've had and then package it in new ways that we can have, an even more aggressive impact over the next 10 years.
Yeah, I think it's fantastic. Glenn Weber, you're one of the founding board members of Healthy Harrison. Kind of give your why. What is your why in getting this whole thing started?
Well, thank you. I retired probably 15 years ago. I had a consulting business for 25 years, and I was in Washington, D.C. and in Columbus, Ohio. And we used to go in and work with businesses to make them more efficient and productive. I retired, sold the business, and then I'm friends with Clay Marsh. And Clay and Bill Ramsey said, why don't you come up and learn about healthcare and help us with some programs. And Clay's, I think, original vision was, we need to stop taking care of people once they're in trouble. We need to make it preventative, and we need to get to them earlier in the system to improve their health. So we've been on this journey for 10 years, and I can't believe what John Paul's been able to accomplish. You will not find a more productive person in the state of West Virginia than John Paul Nardelli.
That's awesome.
So what he's been able to do in the last 10 years in terms of developing programs and having an impact on the community is, I think, unbelievable. And I think he's now, the organization is now ready to go to another level of impact on the state.
Yeah, thank you for that vision. I mean, it's an important thing. It's something that's near and dear to my heart is health and wellness, because of what John Paul talked about, these low rankings. And it doesn't have to be that way, I think.
Well, what's interesting, I think when we talked to John Deskins, he said the three things that impacting West Virginia's economic development are substance abuse, health, and education. And really, this is directly related to improving the economic health of the state, which I think is a huge opportunity.
Yeah, absolutely. Thank you. Amy, now you are the president of the board currently. You've been involved with Healthy Harrison for a long time.
About 8 years I think I've been on the board.
I love it. Yeah, so from your perspective, maybe touch on the economic development impact in your role as not just at Healthy Harrison, but what you also do in the community.
Sure. So my day job is the executive director of Harrison County Economic Development Corporation.
Perfect. Yeah.
So I do I have a seat on the state board for economic development as well. So it's a regional aspect.
Yeah.
And I can spread myself pretty thin at times. So we have to look at different boards and committees when you get on those.
Sure.
Is it going to benefit?
Yeah.
This one directly benefited. You have to look at those thinking health. Absolutely.
Yeah.
When you're dealing with these companies coming in, we're marketing the region, we're marketing Harrison County. We have to put our positives that are out there, but we have to address our negatives. So as the companies are coming in and retaining employees, training employees, what they're looking at is the health of their employees. And they realize, we talked about the numbers, 49th. There are a few of them that were at 50, so we hit the bottom a couple times.
Yeah.
But we're able to tell these companies, at least in Harrison County, in our area, this is what we're doing to combat that. We are working on it. We acknowledge that our where we are sitting with health and the employees, and even at a younger age, even in the school age, as we're training employees and graduating, we're able to use that as a marketing tool. We're able to tell these companies that we're fully aware, but we've moved the needle.
Yeah,
So,
absolutely. John Paul, maybe you could talk a little bit about some of those programs specifically and how you are moving the needle, like Amy just said.
Certainly. So we have a great variety of programming that kind of hits on a different variation, different depth and degree to each one of those projects. So the easiest project we have a podcast. It doesn't do as well as yours, Jim, but it's been very successful. Yeah, we're working on it. But we've reached 250 episodes, which we're very proud of. Yeah. And so that gives us an opportunity to provide a platform for all things wellness. We've had doctors on. We've had community events. Every year we partner to sponsor the Clarksburg 10K, which is a great event. Yeah. So we do all things related to elevating that which is already present in the community. In addition to that, we also have a substance abuse program where, we partnered with you guys on that as well. Yeah. We identified 10 incredible recovery stories. I would encourage everybody to check it out at healthyharrison.org. And these are 10 highly produced, highly beautiful videos that just make sense about the recovery that's happening, because we always hear about how we're last in the opioid crisis, but we're also first in the comeback story, right? Yes. So we're trying to share that story. The third project that we're really proud of is the in-school program that we're doing. We call it Change Your State because we're trying to change the state of health, but we're also trying to change individual state of mind of the students. Obviously, we're seeing growing numbers of obesity and diabetes among youth. And so we really want to start early with intervention, teaching the just fundamentals and basics of wellness and how to be healthy, the choices that you should make with nutrition, mindfulness, and movement. And then finally, we have a signature wellness program that we do in the workplace. And we take a lot of pride in that because not only is it a nice thing for companies to do, but we have impact metrics that really show a correlation between cost savings, which is really, you would think there is more organizations doing that, but that's really been our niche, is making an impact and then tying it directly to cost savings and dollars, which is critical for our community.
It's so powerful. This is Positively West Virginia. We'll be right back.
Your prescriptions are designed to keep you healthy, active, full of life. At Highmark Blue Cross Blue Shield, we're making vital medicine more affordable. Because when your prescriptions don't cost an arm and a leg, you can use those limbs for something more meaningful. Because life. Highmark Blue Cross Blue Shield, West Virginia.
Stay connected with an unbeatable deal from Breezeline. Voted best in Mountaineer Country for their reliable, high-speed fiber internet for a low cost, Breezeline is the best gig in town. Here at InnerAction Media, we rely on high-speed internet every single day to ensure we can deliver the best content possible for our clients and when we publish Positively West Virginia each week. That's why we use Breezeline. It's affordable, fast, and they're great people as well. Learn more about Breezeline's internet, TV, and mobile options at breezeline.com. Folks, we're back. We're visiting with John Paul Nardelli, Amy Haberbosch Wilson, and Glenn Weber. They're all with Healthy Harrison. It's a health and wellness initiative really centered in the last 10 years in Harrison County, West Virginia. John Paul, what is the target reach right now? Is it Harrison County, and how can we make this more of a thing statewide?
That's a great question, and that's really what we're aiming to do. What I would say is that our funders are really wanting us to focus in Harrison County, but we're getting calls, which is exciting, right?
Yes, of course.
And so while we've really put our focus predominantly in Harrison County, we've been able to expand our programming into Berkeley, Doddridge. We were even in Ohio County this year in the school system, Marion County. Those types of partnerships give us the leverage to do expansion. Now, they don't love the name Healthy Harrison when we go outside the territory. So we've also been able to copyright the name Change Your State. And so not only are we working as Healthy Harrison, but we also fall under the umbrella of the Change Your State initiative, which we're very excited about.
Well, that's great. And obviously, just the programming you mentioned, there's other things that you're doing, but that is, in marketing, we could call that the top of the funnel, which is awareness, right? And so you're out there. Everywhere you look in Harrison County, Healthy Harrison has a presence.
Thanks.
And I think that's amazing. It starts with things like the podcast and getting the word out and interviewing these people, but spreading the word because it is such an important issue. Amy hit on the economic development impact. Glenn talked about the overall culture of the state and how do we bring this to fruition. Where does it start? Like with these young people, like we talked about in the schools and whatnot, is it a lack of an education in terms of like the nutrition? Where does it start?
Yeah, that's a great question. And, whenever I'm giving a presentation, I always like to first point out how bad we are right now.
Yeah.
But the second thing I like to do is draw attention to the fact that it's really not our fault. It's taken 4 years to get us in last place, and it's going to probably take us another 40 years to get out of it as far as state metrics go.
Sure.
So the great place to start is awareness. It is drawing attention to the importance of taking care of yourself. And that might seem like a easy thing to do. It's really not. There's so much competition, whether it's your phone or TV or just the types of foods we're putting in our body. The world's working completely against us, for our mission. That's why we have to be all hands on deck. And that's why it's so important to do an integrated process where we're hitting on students, adults in the workplace, and, even community offerings. So awareness is really the entry point for each one of those different demographics. And that's why the podcast has been such a critical piece to that. It really, it's the inroads for a lot of people.
Yeah, and I love the Change Your State because that's really, it has a double meaning. Change West Virginia.
Can I build on what John
Yes,
Paul's
please,
saying?
Glenn. Yeah.
I think that what's innovative about what John Paul and Healthy Harrison has done is it's awareness is where it starts, but what's different is they get down to actually changing people's habits.
Yeah.
So when you said, where does it start? It starts with your habits.
Yes.
And one of the things that John Paul did with a team of other people is go outside the state and learn from experts on how do you change habits.
Best practices.
And what are the best ways to do it? I actually went to Stanford University, interviewed one of the leading people in the world about how you change habits, brought that back, looked at probably 20 different healthcare programs, customized it to West Virginia, brought in coaches that were local coaches to make it very personal and customized, and drove changes in behaviors. And that's when you start to see the economic impact, which is on insurance premiums.
Yes.
They start to come down. Prescription pills start to come down. So there's an actual out-of-pocket expense. So those down at the root level is where John Paul's actually having a major impact. He's then taken that and put it into the school system. Because when you look at the numbers, I think 40% of the children are obese in the state of West Virginia, which is a staggering number. If you add obesity and overweight, it's 70% for adults. That has a direct impact on the cost that businesses are bearing. So this change your habits approach that I think you've really refined and
Tiny
perfected
habits.
is what really
habits.
is what makes a huge difference.
Thank you for that, Glenn. I appreciate the insight. I think of like just my own personal journey, and last year, 2025, I went a year. I eliminated processed sugar from my diet. It was the hardest thing I've ever done. I feel like I was an addict to sugar, and I think a lot of us are.
Yeah.
And you just walk down the grocery store aisles and just be aware of what's happening. We talk about awareness. Just like what it's our own fault, or not our own fault, as John Paul talked about, because we're inundated with options that are just not healthy, right? I think about the school system, and I remember a friend of mine a couple of years ago was doing a backpack after-school backpack program, and he was working on a Saturday filling backpacks to give to these children, and he got so upset because one of the things that they were putting in these backpacks was a 5-pound bag of gummy bears. He's like, that's a 5-pound bag of sugar that we're putting. He goes, I can't do it. He left. And it's just like, that just kind of underscores the importance of what are we doing? And
That's right.
So an organization like Healthy Harrison is going, what are we doing?
Right.
We got to change the habits. We got to get our state changed. Amy, from your perspective, maybe chime in on that. What are you seeing out there?
Seeing as far as
Just changing. How do we change these habits?
We've talked about it, the tiny habits and awareness, one and the same. Something as simple as, John Paul said, you put your tennis shoes on in the morning.
Yeah.
You don't have to have that New Year's resolution that you're going to be at the gym. Just put your tennis shoes on.
One easy step.
And we're saying it, we're talking about it, and then I try to do that. And I realize I wake up in the morning, I put my tennis shoes on, and I feel like, okay, my shoes are on now, so I'm going to do it a little bit more. I'm not walking around barefoot. I'm not in my slippers. You park a little bit further away from the store, and you're aware. You're aware of why you're doing it, what you're doing. I'm going to go a little bit further next time, and then I'm going to add to it. I'm going to drink 2 bottles of water today. Very small goals, tiny goals, but it builds, and it builds because you're aware of it.
Yeah.
One of the things John Paul was doing that was annoying is you get a text at 6 a.m. saying, "Did you put your tennis shoes on?" So,
Oh, that's so good.
That's right.
Yeah.
right? Am I right?
Yeah,
along?
absolutely. I mean, like I said, you've got to bake it into your daily routine,
Yes.
and it's hard because the competition's out there, and so you've got to try to captivate their attention and grab them first thing in the morning, because we know that as the day progresses, as the year progresses, it gets harder and harder. And so keep it simple and keep it top of mind at the beginning.
It's discipline.
Yeah.
Really.
The kids
Habits.
making it aware. Competition has been big. And,
That's good.
In the beginning, when you
Almost
started
like
a couple
some
of the different
internal
programs,
peer pressure.
With the
In a
schools,
positive way.
yes. You compete with each other. You've had
good.
kind of the biggest loser in a different way.
And I've gotten
Competitions
into a
with the
little bit of trouble, to
communities.
be honest with you, because Fairmont is a little bit more competitive than what I'm used to, and we had East and West Fairmont battle it out. And after I made the announcement, the principals sent me emails. They wanted to see where I came up with the result.
Show me the numbers.
I started sweating a little bit because I haven't had that pressure, but I love it too, because
Yeah.
I think it
That's
instills
accountability, right?
Absolutely.
They're aware of it. They're aware.
And it's
they're
fun.
trying
It's so fun, I mean, I have pictures of West Fairmont having won, and the whole school is in front of the building holding this huge trophy. I got them. And I was just thinking, man, that's such a proud moment for our organization that many kids are bought into the program, and
I love it.
it's
Yeah.
exciting.
That's where it has to start, is with those
right.
kids. I
When
love
you're in
it.
every school too, aren't you, in Harrison County?
Every school in Harrison County, middle school and high school, and then we've expanded to 4 other schools outside the county.
Amazing. This is Positively West Virginia. We'll be right back. In a world obsessed with leadership, what if the real key to success is followership? We hear it all the time. Be a leader, take charge. But what if the most impactful people aren't the ones leading from the front? In Humble Influence, I explore how humility, collaboration, and shared purpose empower followers to create meaningful change in business, organizations, and relationships. Discover the strength of true followership with Humble Influence. Folks, we're back. We're visiting with Healthy Harrison, 3 members of that just wonderful organization in Harrison County. John Paul Nardelli, the executive director, Amy Haberbosch Wilson, who's the president of the board, and one of the founding members of Healthy Harrison, Glenn Weber. So thank you guys again for being here. John Paul, what has you fired up right now for Healthy Harrison? What are you excited about?
Thanks for asking. I'm especially excited because we've recently engaged John Deskins, and we brought his name up already. But, he is the leader in terms of economic impact, and we actually have a meeting with him tomorrow morning to go through our different product line and just to get some validation from him that we're heading in the right direction. As I mentioned earlier, we know that poor health outcomes is directly impacting the economic impact, and it's really what we're seeing is jobs suffer, we're seeing the workforce suffer. And so we're meeting with John, and the goal is to really, as I said, reposition ourselves in a way that we're attractive to businesses, investors, whoever really wants to take initiative. Because as I said, while we know poor health outcomes directly impacts the economic disparities, we have yet really to see anybody take charge. And we want to be the thought leaders in that field. Yeah. We want to create the niche that not only do we recognize as a problem, but we've developed solutions.
Yeah, we're recording this in the first part of 2026, February. And just a couple of months ago, going through, all of our insurance premium hikes and so forth. And I was confronted with that. And it really kind of caused our team to be thinking about, our core values. And we've recently, just in this year, instilled the word health in our core values. Hospitality, accountability, leadership is some of our core values. But we put the word health in there. And it's not just physical health, like what we think about, but mental health, spiritual health, the whole person health. And so I'm interested in maybe talking with you, John Paul, about bringing your workplace wellness program here. Maybe we could be a Mon County.
We get a contract.
So, yeah, we could do something, because I love the idea, man, because it is so important what you just talked about, and I think that's really really great. John Paul, from in 10 years, what's one of the most interesting things you've seen come across in this journey?
It's genuinely the people. Yeah. And I know that probably sounds like a soft answer, but I am incredibly impressed by a board of directors. I mean, we've got such a powerful team that are all invested in this vision, and they believe in it. And that to me is remarkable. And what I would say is, in order for this to be replicated across the state, it has to have top-down buy-in, but it also has to have grassroots. So that's sort of a fundamental difference between us, is that while some projects in the nonprofit or health world are grassroots, we are a campaign that unites both the grassroots and grass tops. So we've got buy-in from the top down, and then we've also got the community collaboratives working diligently to want to participate.
What about funding? And you mentioned some sponsors. Can you talk a little bit about who's behind this financially and helping?
Yeah, certainly. So what's interesting about our structure is that WVU, as part of getting us started, provided seed money, and then annually they really equipped us with some funding. WVU Medicine United Hospital Center has been a total monster in that realm. They've not only provided funding, but exceeded really what would ever be expected of a local community hospital. And I think it's incredibly rare that they're doing that. We also have businesses buying in. We partner with the Economic Development Corporation. MVB Bank gives us some cash. EQT, Hope. Hope Energy. So it's just it's been kind of great, because what we're seeing is local businesses buying into what we're doing, even if it's at a incremental level year after year. Community Care of West Virginia, they believe in us. They sponsor our podcast. So it's kind of a whole gambit, and it's all hands on deck, in terms of funding.
Sources,
But certainly we're constantly exploring and looking for ways to expand. We're looking for people that buy into our mission.
Yeah. Amy, are you able to talk a little bit about the impact that you feel that Healthy Harrison's having, not just in Harrison County, but in the region?
I think it's a huge impact. Health of our employees, our workforce. I think a few years ago we look back and you assume that economic developers focus on workforce, but there are workforce groups that do that. That is now one of our key goals that we look at.
It's amazing.
We look at childcare, we look at workforce, and we look at it all relates to health. Yeah. Everything, all the goals that we choose and rotate out, it all relates back to the health. Whether it's in the school system, or it's training your employees, or the employees that are unemployed that are there. The existing companies want a trained workforce, but they really want a healthy workforce.
Yeah.
Mentally, you were talking about that as well.
Exactly.
It's not just your physical health.
Yeah, mental health.
They mentally want them to be there and stay there. Yes, absolutely.
I remember it was right around the pandemic in 2020 era, and I had an employee came to me and said, "Is it possible for me to have a mental health day?" And I'd never heard that phrase before. And now it's everywhere. People are talking about taking mental health days and so forth. So I think it's something that's real. It
is. And we look at some of the healthier communities that are vibrant economically. A lot of those companies have that implemented in their own system.
Yeah.
So we look back at the ones that we have. We have a lot of international companies in Harrison County.
Sure.
And they were already doing this. Yeah. They already have their wellness days. They already have their the sleep pods that are there. They have days for that.
I want one of those.
Yes, yeah.
Maybe we can make a connection there. That'd be great. That would be very cool. So I like to ask this question. I'm a student of leadership, and I've got 3 great leaders right in front of me. So I'm going to ask each of you this question. As you think about leadership today in 2026, what do you think is the most important trait of a successful leader here in West Virginia? John Paul, I'll start with you and we'll work our way around.
Even specifically to West Virginia, you have to buy in to who we are, because I think that you're from here, I'm from here, right? We really believe that West Virginia has a stronger future than where we're at right now.
Sure.
And I think in order to be a leader here, you genuinely have to believe in the possibility and the potentiality of what we have to offer. We have an incredibly beautiful place to live. The people here are so kind and so good. My wife's from Minnesota, and the phrase over there is Minnesota nice. She said they've got nothing on the people of West Virginia. Yeah. So it's really just seeing the potential in what we have here and using that. We learned early on, you don't need an outsider to come and fix the problems. What you need is leadership that invokes and provides the path for the people to utilize the resources that they have here to maximize their potentiality. And I think that that's really what I see you doing. That's what I think we're doing. And so it's just pulling, it's the Avengers. It's pulling all those people together, having a shared vision, and really believing in the future of West Virginia.
I appreciate your thoughts on that, John Paul. Amy, thoughts on leadership?
Some of those I would say the same. Know who you're leading. Depending if it's the head of a company or a community, know who the people are, listen to who they are, find out what their assets are. I don't think you can just come in and not know anything about it. You truly have to take that learning period of, who am I leading? Yeah. Where am I leading them to?
It's relational.
And understanding them. Yeah.
Absolutely. Thank you, Amy. Glenn, how about you? What do you think is the
expectations? I think that you need to keep continuing to grow as an organization and defining what the future looks like. I think one of the things that frustrates me at the moment about Healthy Harrison is it has so much more it can do in the community and in the state. And I think they need additional support and resources to pull that off, because they've got the talent and they can get more talent. But in terms of expectations, I think that's really important for a leader, and to push against complacency.
Yeah, I love that. It's about setting standards, not just for an organization, but for yourself individually. We talked about starting with small habits, putting your running shoes on in the morning, making your bed. How many people don't do that? Right? Yes. It's getting those little habits that discipline. So I appreciate all of you sharing that. I'm going to be taking some notes after this podcast to make sure I'm doing all those things too. John Paul, thank you for holding me accountable. I appreciate that. So, John Paul, from your perspective, somebody may be hearing this in one of our rural counties, somewhere here in West Virginia, they say, I would like to start something like this in our county. How do they do it? What's the best thing?
So I think it really relates to a small local win. we haven't gone to Mars. What we've done is consistently, just like what's Moneyball, we consistently get people on base. So every project that we do, it's a small win. And I think that what I hear a lot of, I was once an ambitious business student who thought, I was going to make hundreds of thousands of dollars right out of school. It takes some humility, right? Mm-hmm. But recognizing that there's incredible importance in doing just something very simple, basic, getting a win, and then building upon that win. The first project that we did was to work with the Greater Clarksburg 10K to increase enrollment. Yeah. Now, again, you could look at that and say that's not a very big project, and perhaps it wasn't. It took a lot of work, though. Yeah. We more than doubled it in 1 year.
Participants.
Yes.
That's amazing. How did you do it? Like, what were the tactics?
It took a great deal of coordination. Mm-hmm. So essentially, I worked directly with Glenn to get the school system involved. Mm-hmm. We coordinated buses, we coordinated teachers and chaperones, we worked with a superintendent, we had special shirts made, we implemented competition, and it was an absolutely great way to celebrate. But in the grand scheme of things, it was a small win that gave us the momentum to then pivot and start to explore wellness programs and begin to create our own products.
I think that's so powerful because a lot of times people have an idea and they want to get to the idea, but they haven't tested it. They haven't looked at the viability of it. They haven't done, proof of concept, right? And here you are. You had an idea. You had one simple goal to start with, participation in a race that had been around for a long time. It's still the Cecil Jarvis 10K, right?
That's right.
And a great leader in his own right back in the day.
Absolutely.
And it was a very, very good race. I actually did the Cecil Jarvis 10K years ago.
Nice.
And I was humiliated because they had Kenyan runners, professional runners, and they lapped me before they finished before I even made my first lap. And I was
they're intimidating.
They're intimidating. Do they still show up? Those professional runners and stuff?
Less to a lesser degree, but they're still there.
It was
they
incredible.
Still make it.
What an event. And, so thank you for that wisdom. And I think it's a good point, whether it's a nonprofit, a startup business, or any kind of an entrepreneurial venture, you got to start with something, and that first step often should just be a little thing, a baby step.
Building on it.
Yeah.
And I wanted to, you said rural communities, how rural community would, it's going to be a little different than Harrison County, but I think you've had to pivot so many times and you've had to just see what works and what doesn't work. Yeah. I want to point out what really works, and I've seen a big difference, maybe not in the economic development realm, but just in the health realm, would be our coaches, our health coaches, and just the little tidbits that they do, not your standard stuff that you would normally see on what to eat. We all know what we should be eating, but they actually take you into the dollar store. They take you into Family Dollar or McDonald's on a limited income on what your choices are.
I love it.
Specifically in West Virginia. A lot of times that's their only choice.
They'd actually go into the store with you.
Yes, they do.
And into your home.
I think it's amazing.
If you want them to.
And that content's sometimes on social media too, right?
Yeah, it's totally free on.
Yeah, so I had seen an episode on social media, I don't know, maybe in the last year or so, and I challenged myself. I said, can I create a meal for less than $10, and healthy meal.
A healthy meal. Mm-hmm.
So I went to Aldi. They're not a sponsor, but I bought a jar of organic, and I have this app. It's called the Bobby Approved app. I don't know if you guys know it, but you can scan a barcode and it's a thumbs up or down, whether seed oils and sugar and all that stuff. Anyway, I got a thing of organic tomato sauce produced in Italy. Organic chickpea pasta, and a thing of grass-fed, grass-finished beef. And I made this pasta meal with those three ingredients and some spices. It was like less than $10. It was like $9.80 or something total, including tax. And my wife and I ate not only our dinner, but lunch the next. I created 4 meals on $10. It was inspired by one of those videos.
That's awesome. Thanks.
And so, and what was cool about it is like, we're like fooling ourselves. People think, well, to eat healthy, you got to spend more money. You don't have to.
Right.
And there's so many options out there. Just to do
And
away
convenience store eating. A lot of them will say, well, I don't have any choices. There's nowhere else I can go.
I know.
And they will walk you through a convenience store.
I know. That's so good.
sheets, and
I
you
love
can-
that, the coaching. So thank you for that, Amy. I appreciate that. So, first of all, we've covered a lot in this interview. Congratulations on 10 years of Healthy Harrison. First of all, this is an amazing accomplishment.
I appreciate it.
We've only scratched the surface on all the things you all are doing to affect health and wellness and vitality in Harrison County and the region, really, because it's spreading. So is there anything else you all want to address and let our audience members know that we haven't covered?
Really just want to thank West Virginia University, WMS United Hospital Center, and really InnerAction, because you guys have really helped us to create a brand. I think that one thing that was prompted by your last question is, I don't. Did you happen to watch the Michael Jordan interview? It's like one interview he did in the last 20 years. And somebody asked him about his brand, the logo. And he said that he found it so interesting that so many players have their own logo, but haven't accomplished anything, whereas
point,
he worked so hard, and then the logo naturally came from that. And so I recognize I'm a brand hog, and I'm just grateful for everything that InnerAction's done for us, because it's elevated. Again, we're telling great stories, but it's got to be high end. It's got to look great. And so I want to thank you for
thank you, John
helping
Paul.
us to tell the
Appreciate that.
story.
Yeah, thank you. Amy, anything that we haven't covered that you would like to talk about?
No.
Yeah,
I hope
you've
you
done a
edit
great
that. I'm
job.
sorry. I was
No,
just
you
totally
did great.
spaced now.
No, you did great, Glenn.
I'd like to thank Dr. Kelly Nelson, who lives in the Harrison County, and I think he was instrumental in developing one of the major programs that John Paul has. And I think it's more complicated than just tiny habits. You need a systematic approach to improving your health. And I think John Paul, over time, has refined a very sophisticated approach that's simple to follow. So I would say for businesses that are interested in improving the health, reach out to John Paul.
Yeah.
If you're rural and you want to learn how to do this, I would probably call John Paul and follow him around. He's a little asking him how he does things is a little bit like asking
Just come
Michael
up and
Jordan how he does stuff. It's not a really clear answer. I'd follow him around and figure out exactly how he's doing things.
Shadow
That's
day.
very true.
A
Yeah.
shadow
Very
day.
true.
Healthy
Yeah.
Harrison. I can see it. John Paul. That's awesome.
right.
Well, John Paul, to that point, how can folks get plugged in to Healthy Harrison? How can they learn more about you and even contact you?
Sure. My email is john.nardelli@wvmedicine.org. And really, I would invite people to check out our Facebook. You can look up Healthy Harrison or search Change Your State. We're putting out content every day. And then, we're excited to release an updated website, which will include our program baked into the website this summer. So really excited about that launch. And so, please don't hesitate. You can call me on my cell, 304-641-8711.
All right. That sounds
Just
good.
throwing
You
it
got
out
there.
Yeah.
Glenn, thanks for that. John Paul's going to have a word with you after
Yes,
this.
he is.
That's great. We'll make sure we have links to all that in the show notes and social media when we promote these episodes, so folks can get plugged in to Healthy Harrison. Our guests once again from Healthy Harrison, John Paul Nardelli, Executive Director, Amy Haberbosch Wilson, who's the President of the Board, and one of the founding members, Glenn Weber. Thank you all for being here. This has been awesome. I'm encouraged, as somebody who has health as a core value right here at our company and an advocate for health and wellness. What you all are doing is just, it's having a massive impact across the state of West Virginia. So thank you for everything you're doing. I also want to encourage you to keep going.
Thank you.
Thanks.
Thanks for
Thank
having
you.
us.
Yeah, absolutely. Folks, that's a wrap on another episode of Positively West Virginia. If you or someone you know would be a great guest on the show, drop us a line on our website at positivelywv.com. And of course, we appreciate your encouragement along the way, commenting and sharing on social media. Great episodes like that of Healthy Harrison. It really helps them. It helps our show and gets the word out there about all the positive things that are happening in West Virginia in business and really an important sector of our economy, which is the nonprofit sector as well. On behalf of our entire Positively West Virginia team, I'm your host, Jim Matuga. Stay positive, West Virginia.
We'd like to thank our partners, Highmark, West Virginia, Freedom Kia of Morgantown, InnerAction Media, Humble Influence, and our studio sponsor, Breezeline, for helping to share these positive stories. If you'd like to become a sponsor of the Positively West Virginia podcast, visit positivelywv.com/sponsor.